Welcome technicians. Today we look into the blood storage part of our lab. Okay. So as you are aware, so managing the blood components in our hospital is also one of the part of our laboratory work only. Okay. So what normally happens is whenever a patient requires a blood component, so the respective wards or the IP, OP or dialysis or emergency people, they will call and ask whether the blood is available or not. So whenever they call, you have to have this particular form which is there in our lab, and you have to enter all the details of that. Say for example, you have to enter the name of the patient for which the blood is being asked, write down the date and time at which you are receiving that particular phone call, UHID number and age of the patient. Okay, so like this. So which staff is informing you from that particular ward or particular room, so that you mention, and your name also you enter. Who is the primary doctor who is asking for that particular component is also you enter. So what is the blood group of that particular that they are requiring, and what is the RH of that particular this thing, and then what component they are asking, whether they are asking for packed cells or platelets or fresh frozen plasma or cryoprecipitate, whatever is that, so that you note down how many quantities of they require. So sometimes multiple packet cell, platelet, everything will be asked. So based on that, how many quantities you are required, and what is the reason for transfusion. The reason for transfusion is very important, because for some of the major surgeries, the corrected dates and other things we have to look at. For the newborn babies and all, we try to give a fresh blood only. So for that reason, what is the reason for transfusion, you have to always enter, and then ask about when do they require. Is it an emergency, immediately they want, or it's today if they can get it, it's well and good. So at any time, sometimes this is required for a the next day's surgery or a scheduled operative procedures or something like that. At that time they will tell exactly when is the surgery and at what time it is required. Okay, so then you have to check about what type of patient it is, whether it's an insurance patient or any scheme patient. This is the reason being that some schemes don't allow blood components as a part of the revenue transactions. For that reason, we need to check whether the what type of patient it is. Now most of the time some doctors, they want only reserve, means they want the packet cells to be present for them. They neither they want it to be cross matched, nor they're unlikely that they might use. They are just keeping it as a precautions. During that time you have to mention it as to be reserved only. Sometimes they are under the they might use it, and when they are using it they might not have a lot of time, in a nick of a moment they may require. So during that time they ask you to cross match and then keep it. Okay, and then sometimes they know that they will require, so it will be used. Okay, like that. So this also you have to ask them, and then you will inform the particular sister that whether the blood is available, not available, what exactly has to be done. So in this case we are only give it from our blood storage, so we have informed that we will be giving it from our blood storage facility for this particular patient. Okay, so then subsequently they will send the blood requisition form with the patient name, UHID number, what is the blood group, why they are doing it, all these things. Along with that they send an EDTA sample also for us to cross match and all. Okay, so this is how it is done. Now this is not possible every time that we have the blood in question. So during that time what we will do, once we take out all these details, so immediately we call the respective, we start searching in various blood banks where the particular components are available. Okay, so we try, some of the patient may require multiple components and all. So try to arrange all these bloods in a one particular blood bank. If it is not possible, try to arrange in a different this thing. Okay, so but when you call the blood bank, please make sure some of the things, like for example, if their component is available for that particular patient, always ask for about whether the donors are required or not. If donors are required, you have to inform the nurse regarding that. And even the donors also, same blood group donors are required or any blood group donors are required, that also you have to inform. Now this information, once you have it, so you call this particular ward, inform the nurse and the MOD at which particular blood bank the components are available, and how many donors are required or donors are not required. All these details you note down and you inform to the particular nurse. Okay, now few times it so happens, especially during some specific part of the years and all, due to festivals and other reasons and all, there is the city will be out of blood. So during that time, even after checking all the blood banks, there is a likely chance that you may not find it. So during that time you don't have to panic. You just inform the particular nurse and the manager on duty that we are not able to get the particular component, so let them try other methods. Many of the times patients will have their own donors or their own relatives or somebody, or they may be knowing some blood banks and all, so they will try to arrange it themselves. So our requirement is to make sure that if it is available, we make sure that it is there. Okay, so during that times, so whenever you arrange the blood in and outside, so you mention, you take out all those details that is required, and then you mention where, which blood bank it is urgent, and at what time and date and time you have informed that particular staff where it is available and all. These are all important. These are all important documents. You have to make sure that these are all kept ready. Okay. Now once that particular, if it is an outside blood you are receiving, so once it is available, so all these compatibility form, adverse reaction forms, even the payment details, bills, all these things also is brought to the lab. So you give back all these bills. You keep only the blood component, and the component one form will be there, which is that blood, what is that patient name, all those things will be there. That is the component at a card. So only these things you keep it with you. All other details you give it back to the respective ward only. Okay. So packet cells and FFP, since this FFP will be already thawed, so you need not have to keep it in -40, so you can keep it in the blood bag refrigerator only. Okay, packet cells will be obviously there. If it is a platelet has come, then you have to keep it in the platelet agitator only. Okay, now document all these details in the computer. This is a part of our operating procedure, which I will discuss in the respective this thing. Okay, so this is also an administrative work which lab technician should know. Hope you are able to understand how the blood and blood components are handled in our lab. Okay, thank you.